So when we begin to address physical therapy needs for a child, oftentimes we immediately look at the child, him or herself. We really focus in on child health and development. And that's clearly a really important aspect on managing physical therapy needs for a child. But focusing solely on the child's health and development is really a very traditional way of addressing physical therapy needs for a child. And over the past couple of decades, we've really started to have an understanding of how much the child's environment actually influences his participation and outcomes, and how important it is for our interventions to really not just address the child, but also to address the child's environment. And that means the social and caregiving environment of the child, as well as the actual physical environment of the child. And so this figure here does a pretty nice job of illustrating the complex and interactive nature of contextual factors on child participation and outcomes. And so this figure looks at the environment in a couple of different ways. First of all, it looks at the contribution of the distal environment, so the neighborhood or community in which the child lives. And it also really looks at the proximal environment, so the child's family, the home, the caregivers, the culture in which the child lives, all are parts of the proximal environment. And it may not surprise you to know that in very young children, the proximal environment is much more influential, whereas as children get older and become adolescents and even into young adulthood, the distal environment becomes much more influential as they start to go out to school and have friends and participate in clubs and things like that. For the purposes of this discussion today, we're really going to sort of focus in on the proximal environment. So there are a number of family factors that influence intervention. Family structure, family function, and family resources can all have a pretty significant impact on the child's health and development, and subsequently on outcomes and participation. And so these are all things that we really have to consider when we are coming up with a management plan and intervention plan and strategies for a child. So first, let's look a little bit more closely at family structure. So when we look at family structure, we're going to look first at the caregiving family. So who lives in the home? What's the ratio of children to adults, and how do those people interact with each other? And that sort of also overlaps into the household composition. So we really are interested in who lives in the home, who is in and out of the home often, who are the primary caregivers for the child. Is that a parent? Is it a grandparent? Is it a child care provider? Is it a family member? Are there siblings in the home? All of those things are going to really influence that child's health and development. And we also want to know not just who's in the family and who are the primary caregivers for the child, but how do those people interact with the child and also with each other. And all of these things, the caregiving family, the household composition, and the interactions between family members can really influence family functioning and resources, and also can be very protective and positive for the child, or can be very stressful for the child development or well-being. We also want to look at the family function. Family function refers to the family's ability to conduct and accomplish everyday activities across situations. So really, this is the ability of the family to carry out day-to-day routines. So in addition to understanding the family's normal routines, we also want to understand parenting behavior and child-rearing beliefs in the families. Child-rearing practices reflect beliefs, ideas, perceptions, expectations, and attitudes about parenting and children. They can also reflect current trends in society and information gained through the media. So it's important to have a good understanding of the child-rearing beliefs of the primary caregivers in the child's life. We also want to understand parent-child interactions. Parent-child interactions become the basis for subsequent relationships that children form later in their lives, and there's some evidence that parent-child interactions have quite a large impact on the way that children develop even into adulthood. Culture plays an enormous role in the function of a family. Culture is really the heart of parenting behaviors. It's shared and valued by other members of the group, passed on between generations, and can influence the decision-making power in a family. So physical therapists who are working with families really need to learn about a family's culture, and they must respect the uniqueness of each culture and really try to design interventions and have discussions with families that are respectful and sensitive to cultural needs of that family. Parenting stress and coping can often play a pretty significant role in family functioning. Stress can impact parent and child interaction and family function. And so therapists should really aim to provide services to relieve stress and the burden on the family. Now, this certainly doesn't mean that physical therapists need to act as mental health professionals, but it does mean that when we're thinking about interventions, we need to really be thinking about what we can do to help that child more fully participate in their daily routines and in their daily care so that we can really make family life a happier, more joyful time and much less stressful for the child and the family. Of course, if we really do identify significant stress and coping needs in a family, we also can be instrumental in helping refer families to specialized mental health services so that they can get the help that they need if they do need that type of extra help. And then finally, when we're looking at family function, we also need to take a look at caregiver health. Oftentimes when we're serving children with special needs, we focus so much on the health of the child that we don't really pay as much attention to the health of the people who are giving care to that child. And research shows that caregivers of children with disabilities actually have higher instances of poor health themselves. And this can really impact the ability of the caregiver to care for the child. So again, we need to help families access good health care for all members of the family. Make sure that caregivers are healthy, both mentally and physically. And if they're not healthy, then we need to really be mindful of that when we're designing intervention plans, that we are respectful and understand whether or not the interventions that we are and strategies that we're asking families to carry out on a day-to-day basis, are they really realistic, given the health of the caregivers. Family resources are also a very important consideration when working with families. First of all, socioeconomic status is a pretty significant factor. Children of families with low socioeconomic status are overrepresented among children with disabilities and developmental delay. So, in other words, there are proportionally more children who are low socioeconomic status who have developmental disability and delay. However, those children are less likely to get a full complement of services because they really don't have the resources and the access to good quality health care that children do who are in families of higher socioeconomic status. So it's really important for us to consider the family's socioeconomic status. We also need to consider their level of informal and formal support. So when we think about formal support, we're talking about sort of professional support and programs that they're involved in. So we need to know what sort of formal support the family has. And then just as importantly, we need to understand the informal support that that family has. Is there extended family that lives in the area? Does this family have support? Do they go to support groups? Have they been matched with other families who have children with similar needs? Do they have friends in the area? Are they part of community groups or some sort of a church group or a faith-based organization? All of these things are really important to helping families cope with and care for a child with special needs. And then finally, the home environment itself is certainly an important family resource, and the home environment is going to influence the family and may influence development. And it's certainly going to influence the types of interventions that you're able to carry out and that you plan for the child. When you think about providing services to a child who lives in a two-story house with a large yard and a big play structure in the backyard, on a cul-de-sac with a sloped driveway, versus a family who maybe lives in a very small home with multiple family members and no yard, a broken sidewalk, and a park down the block, the interventions are going to look really different, and what you recommend for those families are going to look really different based on their home environment. So when we kind of take all those considerations together, we're really talking about trying to provide family-centered care. So what is family-centered care? Well, this is the definition by Law and colleagues, and it's quoted in your Campbell textbook. And it says that family-centered care is made up of a set of values, attitudes, and approaches to services for children with special needs and their families. Family-centered service recognizes that each family is unique, that the family is the constant in the child's life, and that they are the experts on the child's abilities and needs. The family works with service providers to make informed decisions about the services and supports the child and family receive. In family-centered service, the strengths and needs of all family members are considered. So when trying to provide good family-centered care, what are the key elements or the main things that we need to accomplish? Well, first, we need to recognize the family as a constant in the child's life. We need to facilitate family-to-family networking. So we really need to try to help match families with other families that have children with special needs. And oftentimes there are even programs that have parent-to-parent matching. We need to promote parent and professional collaboration. We don't want the professional to come in and present themselves as the authority and the decision maker. We really want that to be a very collaborative relationship. And we also want to incorporate the developmental needs of children into healthcare. So instead of just really focusing on medical needs, we need to be a little bit more broad and a little bit more holistic and really look at what their developmental needs are. And particularly developmental needs in the context of the family's routines and participating in family routines. We need to implement programs and policies that provide emotional and financial support to meet the needs of the family. We should honor diversity, racial, cultural, socioeconomic, and ethnic. And we need to design healthcare services that are accessible, flexible, and responsive to the family's needs. So we really need to think about individualizing each child's plan of care to really help be responsive to the needs of that specific family. And when you're truly practicing in a family-centered way, what you're really doing is you're extending the role of the family to truly become the beneficiaries of intervention. So instead of just thinking of the child himself as being your client, what you're really doing is you're opening that up and you're looking at the family as your client. And maybe even beyond that, maybe you're looking at caregivers, other caregivers as your client. And if you're working in a childcare setting or a school-based setting, you're looking at making the teacher. You can just insert the word teacher for family in these slides and think about that you're making the teacher is actually your client. So you're really thinking beyond providing services just for the child, and what you're really trying to do is design services for all the people that are a part of the child's day-to-day life. Family-centered care expands the role of service providers to provide services to family, and then it also expands the role of the family so that they become a more active participant in the process. They're not just bringing their child to therapy and sitting in the waiting room or standing to the side, or you're not just coming into that home or childcare setting and doing therapy and leaving, but it's really a collaborative process where you're both kind of working together. And the family, in a family-centered care model, the family is not only a part of the team, but the family is also a key member of the team. And remember, we really want to respect the family as the constant in the child's life and really the key decision maker and the child's first and best teacher. So the goals of family-centered care are certainly to enhance growth and development of the child and to also support the child, but also to support the family.